So when I started doing therapy sessions with sports people, I realized that the material coming up was so important to be heard. And of course, confidentiality means it can never be heard. It can never be disseminated on any public platform. So I went to Talk Radio and said, look, I think there are some extraordinary stories. And they said, well, I don't think you're going to find anybody who'll come clean on the radio. All right, but I tell you what, in the unlikely event you can find somebody, we'll give you an hour. So I went back to my clinic in London, which is called Cognacity, and told them about what had been said to me. And they said, we've got a guy called Duncan Bell who used to play as a prop for England. He's been very open about his mental health.
This is in rugby.
This is in rugby, yes, sorry. It's rugby union, the 15-a-side code here. Just had the Rugby World Cup final. So this chap, Duncan Bell, had his well documented struggles of depression and anxiety whilst a player, and he did this what was essentially a pilot, and we had such an unbelievable response. And I just thought, here is a chance for average people to know that there are sports people feeling exactly the same thing, because once you realize that these huge icons, these gods of the game, these gods of sport are suffering exactly the same things that you are, it encourages people to come out. talkSPORT, which is a national radio station here in the UK, is mainly aimed at young men aged 25 to 50. And that is an area, sadly, of our demographic, which is most susceptible to suicide. And if I could just save one person, if somebody could just listen to a show and think, you know what, I'm not alone. I'm going to go seek help. I'm going to seek a counsellor. I'm going to ring the Samaritans, who are a anti-suicide helpline here in the UK. You know, if we can just save one person, you know, the whole of it is worth it. And talkSPORT were blown away by the Duncan Bell episode, and we've now recorded about 26 episodes with various sports people who've been absolutely fantastic, sharing their time and experiences on national radio, and basically saying it's okay. You know, if you do have a mental health issue, it's absolutely fine. Come and find help. It's normal.
More radical candor.
Very radical candor. The wonderful thing is I can employ my radical candor at sports people in a way I can never do as a sports broadcaster, because the people who you're interviewing after a match, after a soccer game or any sports game, would not allow you to ask the questions that as a psychotherapist I can ask.
And so what kind of issues have been brought to light in the interviews that you've done on talkSPORT?
Yeah, we've come across issues around homophobia. We've come across issues around anxiety, depression, addictive behaviors, family loss, bereavement, loss of form, homesickness. It's just about right across the board. All the things that you would expect from any psychotherapeutic interaction between a therapist and client.